Maayong adlaw everyone! Welcome back to my channel. If you are new here to my channel, my name is Cor and I'm your district nurse from Southeast England. Welcome back to my current subscribers. If you are new here to this channel, please don't forget to hit the like button and subscribe to this channel. In today's vlog, I'm going to share to you what are the most commonly asked questions when you apply as an agency nurse. Take note, I won't be giving to you the exact answers to those questions, but I will just guide you in your preparation for your interview. Okay, so let's start. So the first question will be relating to your employment history. So you will have a short conversation with the interviewer concerning your career background. So one of the questions they will ask you is that, what is your specialty? Is it adult nursing or mental health nursing? So in order to answer this question properly, like if they ask you about your work history, you should have your CV with you during the interview so that you can keep track of your dates of employment. You will be asked by the interviewer if you have experience in the hospital setting or in the social care like care homes. So basing on your answer to this question, the agency will be able to determine which shifts are they going to offer to you. So it's either hospital or nursing home setting. The second question will be relating to NMC Code. So you have to learn and understand the NMC Code by heart. So NMC Code, it revolves around 4 P's. And these are prioritize people, practice effectively, preserve safety, and promote professionalism and trust. So example for a question relating to NMC Code would be, what are the principles of good record keeping? So you have to research about that so you would know what to answer to this question. Now let's proceed to our third commonly asked question, and this is relating to medication. So the interviewer might ask you what are the rights of medication administration. So basically we only know 5 and then it evolved to 7. So we have right patient, right medication, right dose, right route, right time, and then eventually it has reached to 10 rights. So we have right to refuse, right to patient education, right to documentation, right assessment, and right evaluation. You will also encounter questions relating to drug administration errors. So for example, they will give you a situation like, this patient is allergic to penicillin, but you accidentally administer a medication containing penicillin. What would you do? So this is basically what is your course of action if you make a medication error. So you have to familiarize yourself with the medication error policy and procedures in a hospital setting or in a care home setting, depending in which area you are planning to work to. Another commonly asked question would be, what is equality and diversity? So this is a very straightforward question. However, if you're not really familiar about it, you can research so you would know how to answer this question, okay? Another question that you will likely encounter would be, what are the types of abuse? Although it's a very simple question, but just in case you're not aware that there are several types of abuse, especially relating to health and social care. So just an example, we have discriminatory abuse, we have organizational or institutional abuse, financial abuse. So other are the basic ones like physical, sexual, emotional abuse. Okay, so read more about the types of abuse in the health and social care. Okay, so number 6 commonly asked question would be relating to news score interpretation. So they will give you a situation like, this patient is coming from like operation or has a health condition like this and like that, and they will give you this news score. What would this score indicates and what will be your course of action? So you know that if you have a high news score, the higher the score, the greater the clinical risk. So you have to familiarize yourself with the interpretation of the news score and what will be the course of action to take. Another common question that you will encounter is about pressure wound prevention and management. So they will ask you, how would you prevent pressure sore? So basically, your answer to this question will evolve around risk assessment and your care plans, and of course, the use of equipment like pressure relieving mattress or creams like barrier creams. So research more about pressure wound management because the UK healthcare is really particular when it comes to preventing pressure sores to the patients and for the residents if you're working in care homes. Now we are down to our last commonly asked question. Actually, this question is one of the initial questions that they will ask you. So this is concerning about orientation and handover. So the question would be, you are working in that specific area like medical, surgical, whatever, for the first time. What would be the information that should be relayed to you apart from the handover? So what would be your answer? Okay, so you got it right. It's about fire evacuation plan. So since it's your first time in the workplace and you're not familiar with the setup, you should be aware on their fire evacuation plan. So if anything happens, you would know where are the fire exits located. So apart from knowing the fire evacuation plan, you also need to be oriented on how to raise an alarm during emergency situations. So including in that orientation is for you to familiarize where is the crash trolley located, okay? And that's the end of our commonly asked interview questions as an agency nurse. But if you want to prepare more for your interview, please watch my other vlog, which is Care Home Nurse UK interview questions. There are also questions in there that can be applicable in your interview as an agency nurse, so please check that out. So hopefully you find value from this vlog for today. If you find this informative, please hit the like button and share this video. Thank you for watching this vlog for today. If you are new here to my channel, what are you waiting for? Please hit the like button and subscribe to this channel. And if you want to be updated for my latest vlogs, please hit the notification bell. Thank you again. I'll see you soon. Bye-bye!